right, so I'm going to talk a little bit about the sterilization room. So we're going to start with the differences between the two sides. So this is your dirty side, and it's super important to remember that dirty things stay on the dirty side. They will never cross. This is our clean side. So things that have been sterilized, things that have been disinfected, things that are ready to be used will always stay on the clean side. So make sure that you know exactly in your office, wherever you're at, what is the dirty and what is the clean side, and make sure you never cross this middle line between them. So we'll start over here with our Statum. So our Statum is a lot like the autoclave that we talked about earlier. It is a steamed system that will be used to sterilize instruments. The only thing about the Statum is it is faster. So if you are needing an instrument right away and you aren't able to use the autoclave and wait for that time, the autoclave takes about 30 minutes to an hour. So this will be a lot faster, usually about 15 minutes. It usually cuts it in half. The thing about the Statum as well is you can't put as much in it. Like I said, it's usually used for smaller instruments that are needed to be used right away. So you'll place it into the cassette. The cassette will close. It will then go back in. The buttons up here are also the same thing, used for pouches or instruments that aren't wrapped. It also remains with distilled water. So that's the same kind of concept with the Statum. You will also always have your gloves that stay in the sterilization room, so you don't have to run back into the operatories to get them. You also have all your cavicides and all your wipes that will be for your sterilization room. So right here we have this thing called a cold sterile. The cold sterile is used to sterilize things that cannot go through the heat, such as these little mouth openers, as well as also sometimes more of the rubbery materials that can't go through the heat. They will need to go through the cold sterile, and I'll talk a little more about what is all in the cold sterile. So right here we have our sharps container, as we talked about earlier. This is where all our needles and our carps go once they've been used. The thing about it too is, so once this gets high, as you can see, this one is a little full, we will take this top part, we will place it on here, and it will be sealed and locked. And then we will call the disposing company. They will come and pick this up. That is the proper way to dispose of our sharps, is to call them and have them dispose of it for us. So this is our ultrasonic cleaner. Like we talked about, all our instruments will go in here. Besides the instruments that do not go in there will be the hand pieces and the hygiene cavitron. Those things will not go in there, or will ruin them. So everything else can go in here, and it is pretty much water with tablets that are located in here. The Maxzyme tabs. I don't know how to say that correctly, but it's a blue tablet, and it will go in here. It'll change the water blue, and it's a disinfectant that will make sure that all of this, all of the stuff inside of here is disinfected. The ultrasonic will shake, which will allow for the debris and the blood and the saliva on the instruments to be shaken off. After that, they will get rinsed in the sink. From the sink, they will go into individual bags. Like we talked about, there's a small, medium, and large. The bags will then be stamped to know the correct date, and then the bags will then go into our autoclave, which we started earlier, and we showed you guys how to start that. We also started our dry heat sterilizer, which has our burrs in it. So once the autoclave is finished, or the dry heat is finished, and once they are done drying, we can, I'm going to take off my gloves. We can take the things from the autoclave and we can bring them over to the clean side. They are now currently clean. As you can see, we talked about there was that pink dot on those ones over there. Now it's a grayish. So that's how we know that it's clean. And we also have our correct date, knowing when we stamped it, things like that. So these will all be put away shortly. We have disinfected our trays. We have wiped them down with our cavicide and made sure that they are ready so we can start making our trays again. Our trays will be on the clean side. In this office, they are color coded based off of what procedure you're doing. So as you see the different colors, that is one way that they stay organized, knowing what procedure is what. So for crown preps, we have our green. For our root canals, we have our yellow. And then for our orange, we have our fillings, which they also have a green one for dentures. So that's a little bit about this side. All the clean instruments will also be on the clean side. So they will be all throughout the drawers. You never want, like I said, you never want to go from this side to this side. So make sure that if you are coming over here and you're opening up the drawers, if you're grabbing any bags, make sure that your gloves are clean or they are not on and your hands are clean. So there's some things about that side, this side. Just always remember which side is clean and dirty, and just keep those sides separate and keep them clean. So that's your sterilization system.